spread of measles continues to be a problem in several states across the U.S., including Texas and New Mexico.
We've been talking about this. Health experts here say there's no concern for cause in Utah just yet, but that doesn't mean we're not entirely not at risk. ABC4's Jensen Kim has more.
Measles is spreading in America. There's already been 3 outbreaks this year and 2 related deaths. The total number of infections now tops 200. That's concerning considering that in just the first 3 months of 2025, the measles case count is catching up to what we saw in the full year of 2024.
Cases in the U.S. typically occur when someone lives or travels outside of the country and brings the disease back with them.
And they spread fast among communities with low vaccination rates. So far, 12 jurisdictions have reported confirmed cases, and most of those cases are centered in Texas and New Mexico.
Outbreaks like the one currently in Texas and New Mexico, with so many patients infected, are very uncommon.
Utah had no reported cases of measles this year or last year, but that doesn't mean that Utah is immune.
I was also wondering the chance of a spillover in the state of Utah as well.
There is always a risk if you share a border with someone for that, but I think it's even greater than that. I mean, we live in an incredibly interconnected world now where I can get on a plane and in 12 hours be on the other side of the globe. And if I'm infectious, I can bring it there as well.
Experts say that vaccines are the best bet against measles. And to make sure that the disease doesn't spread, a community should strive for a 95% vaccine coverage. But here in Utah, about 90% of 2-year-old children are vaccinated against measles, according to Utah Department of Health and Human Services. And that number is lower for some rural communities in Utah.
In theory, if we do get to a point where we have complete vaccination coverage across the globe and this virus can't spread, we can actually end measles virus.
Adults can also get up to date with their measles vaccinations, but there's absolutely no need for a booster if they've already gotten the 2-dose shots as a child. If you're unsure whether you're vaccinated, most Utahns' immunization records are available on the Docket app or website. Jensen Kim, ABC4 News.